Something funny that my mom used to say to me growing up was that I had champagne taste on a beer budget. But come on, who doesn't love the good things in life? The thing is, sometimes those luxury items can often be outside my budget. Yes, my mom was right. But that was until I discovered Quince. Quince is now my go-to for luxury essentials at affordable prices. Priced at 50 to 80% less than similar brands, Quince has a little bit of everything. 100% Mongolian cashmere sweaters starting at just $50, washable silk tops and dresses, and even 14-karat gold jewelry. Everything I've purchased from Quince so far has been absolutely divine. I have a beautiful navy blue boat neck cashmere sweater that I wear with absolutely everything. And I recently purchased a chic leather tote that fits all my work essentials. And let me tell you, these items look and feel so much more expensive than they actually were. Give yourself the luxury you deserve with Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Today's show is sponsored by strawberry.me. As nurses and future nurses, so much of what we do revolves around solving problems. So that when it comes time to focus that attention on ourselves, it can sometimes feel overwhelming. I've recently felt so overcommitted and like my days just spiral out of control. So I decided to try something new. I decided to try personal coaching with strawberry.me. It has been so incredibly eye-opening. My coach Anne asks me such great questions and helps me focus on what really matters. She's not telling me what I should do. She's helping me discover what is going to help me reach my goals. With Anne's help, I've set up consistent routines and daily habits that have made a huge difference in my overall well-being and help me feel like I'm finally back in control of my days. With strawberry.me, you're connected with a coach who's perfect for you, often in as little as 4 hours. And I love that Anne checks in with me periodically to see how I'm doing. It's a great motivator and reminder of the goals I've worked toward. Visit strawberry.me/nursemo. That's strawberry.me/nursemo and take charge of your future with the help of a certified coach. And get a $50 credit when you sign up at strawberry.me/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. Well, hello, and welcome back to Mo's Monday Minute, where I share a quick tip that can help impact your nursing practice right away. And today we are looking at a question that gets asked all the time, especially if you're caring for elderly patients, and that question is this dementia or is it possibly something else? So something I learned very early on in nursing school because I actually saw it in action, and of course we all learn best when we see something in action, is that one of the most common causes for acute confusion in the elderly is not dementia. It's not a worsening of dementia. It is a urinary tract infection. Many times families will think their elderly loved one is starting to show signs of dementia, and that's very, very troubling for families when actually grandma or grandpa simply has a UTI. Not that UTIs are nothing to be concerned about, but a UTI can pretty easily be fixed in most cases, whereas dementia is obviously a much more long-term and debilitating condition. Now, what makes a urinary tract infection so difficult to notice in the elderly is that it doesn't often have those classic signs and symptoms that we're used to seeing, like pain with urination or fever or an elevated white blood cell count. So If your elderly patient becomes confused, or you hear from, maybe it's in your own family, that your grandma, your grandpa, your great-grandma, your great-grandpa might be showing signs of dementia, that's kind of come on suddenly and seems like their behavior is quite a bit different than normal, they could be having a UTI. If you're in the clinical setting and you notice this in your patient, you need to advocate for urine testing. And I would say advocate for this regardless because it happens so often, but be especially aware of it in your patients who are at high risk for UTI. That's going to be your patient with an indwelling catheter. That's your biggest risk. Also, patients with incontinence and high blood glucose levels and urinary retention, patients on corticosteroids, all those kinds of things that put the patient at high risk for infection. So there you have it, your Mo's Monday Minute. I hope it has helped you, and I will see you again very soon. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.